How is thyroglobulin used to monitor thyroid cancer after thyroidectomy? Monitoring thyroid cancer after surgery involves a special protein called thyroglobulin. This protein is made only by thyroid cells, including cancerous ones. When the entire thyroid gland is removed through surgery, measuring thyroglobulin in the blood helps doctors see if any thyroid tissue remains or if cancer has come back. Right after surgery, doctors usually measure thyroglobulin to set a baseline. If all the thyroid tissue is gone, levels should be very low or even indetectable. If levels are higher or start to rise later, it might mean some thyroid tissue or cancer cells are still there. Sometimes, doctors also measure thyroglobulin before surgery to better understand how levels change after the operation. Since thyroglobulin is only produced by thyroid tissue, its presence in the blood after surgery acts as a marker for thyroid cancer. If the levels go up over time, it could signal that the cancer has returned, even if scans do not show anything yet. To make the test more sensitive, doctors often check thyroglobulin when thyroid-stimulating hormone levels are high. TSH makes any remaining thyroid or cancer cells produce more thyroglobulin, making it easier to detect small amounts. This can be done by stopping thyroid hormone therapy temporarily or using a special injection called recombinant human TSH. Doctors usually measure thyroglobulin every 3 to 6 months during the first year after surgery. If levels stay low or indetectable, the tests may become less frequent. Long-term monitoring is important because thyroid cancer can come back many years later. When interpreting the results, if thyroglobulin is very low or not detectable, it generally means no residual or recurrent cancer. If it is rising or still detectable, further tests like imaging scans are needed to find out what is happening. Sometimes, the presence of antithyroglobulin antibodies can interfere with the test, making results less accurate. So, doctors also check for these antibodies at the same time. Even for patients who do not receive radioactive iodine treatment after surgery, thyroglobulin levels tend to decrease over time if no cancer remains. Regular monitoring helps catch any recurrence early and guides additional treatment if needed. In summary, measuring thyroglobulin after thyroidectomy is a key part of keeping an eye on thyroid cancer. It provides a reliable blood marker to detect residual disease or recurrence, helping doctors make informed decisions about further testing and treatment. Always remember, individual cases vary, so it is essential to follow your healthcare provider's advice and schedule for monitoring.